Hello everyone, Dr. Aditi here. Today we're on Anatomy and Physiology Made Simple. We're talking about a thenar muscle, which is going to be in this padded area close to your thumb. It's actually the most radial of the thenar muscles, and it's called the Opponens Pollicis. This is a small muscle, but it enables you to do opposition, right? Helps you hold a pencil, zip up your jacket, text your best friend, right? Because we've got opposition. That's its signature superpower. So let's dive in. All right, Opponens Pollicis. Think opposition performer. That's what I try to remember. And it's actually one of the three muscles that make up the thenar eminence, like we talked about in this area, right? This chubby part of the base of your thumb. And there's a quick memory trick to remember these three thenar muscles. It's actually called O.P.P.O.N.E.N.S. So O is the Opponens Policis, which what we're talking about today. But I do want you to know the other muscles, so you have some relevance here. Abductor pollicis brevis is the one right next to it, actually superficial to it. And then flexor pollicis brevis. And I do have videos on these muscles too, so do check them out if you want to learn more about them. Right, let's look at the origin and insertion. Origin is going to be in the flexor retinaculum area, actually at the tubercle of the trapezium. That's where it's going to sort of originate from, right? And then it inserts into the lateral side of the first metacarpal. So this is your first metacarpal, and it's going to sort of insert right there in that spot on the lateral side of the metacarpal bone. Not the phalanx, but the actual bone of the thumb base, right? It's not actually in the phalanx area, it's actually in the thumb base area. So just something you want to remember, that is your origin and insertion. Right, and looking at the innervation of Opponens Pollicis, there are actually two nerves you need to consider. The first one is the recurrent thenar branch of the median nerve. Root value is going to be C8, T1, and occasionally by the deep terminal branch of the ulnar nerve. So, it could have both branches. So the mnemonic to remember this is most fingers are median, but deep thumb is going to get ulnar. That's another way to sort of remember it. But those are your innovations for the Opponens Policis. Right, so what exactly is the function? We've already talked about it. You know, based on the name, that it's the master thumb for opposition. So basically your thumb is going to rotate a little bit, flex, and it's going to meet the pinky. That's essentially what it's going to do. So the mnemonic here is opponent opposes, like your thumb saying hi to your pinky, right? That's exactly what it does. So it's pretty easy to remember because the name tells you sort of everything. So what would be a test for the Opponens Policis to ascertain whether it's damaged or compromised in any way? Well, what you would do is ask your patient to touch their thumb to their pinky like this, right? And you could have them touch every single finger, and that tells you about opposition, right? And also make sure that you are actually creating like an O when you are having them touch, right? And then this area you can palpate, and that's going to be your Opponens Policis. You can actually feel it moving when you do that. So that would be your test. Right, the other thing I wanted to show you is the manual muscle test for the Opponens Policis. So as you can see in the picture here, or on the slide, you would ask your patient to do that, and then you would want to provide resistance here and say, don't let me pull your fingertips apart. That's essentially what you would be saying. So that would be a manual muscle test for that. Now remember, the Opponens Policis is a big clinically relevant muscle in that we use it for buttoning, writing, anything where you need that little pinch. Obviously any opposition, grabbing a mug, anything like that is going to be impacted if this muscle is not functioning well. So definitely something you want to be aware of. Okay, just to recap, and actually opponens is the perfect mnemonic for this. So O is origin. We know it originates in the flexor retinaculum area and the trapezium bone. Then it goes to the palmar side of the first metacarpal, and that's where it inserts. Now P, the second P is for it's powered by the median nerve for the most part. O is for opposition, we know that. And when you're testing, you want the nails to sort of test. So it's a nail to nail test, and you want the your arm elevated and resting on the table when you're testing so that no other muscle is compensating, right? And then N is for nerve exception, that in about 20% of the population, it is also innervated by the ulnar nerve. And then S is for that it's super important for grasping. Yes, I was reaching there, but that's okay. It's super important for grasping or pinching motion. So that's just a quick mnemonic and recap for you. As usual, I always like to end with a mind map of whatever I'm teaching, and today it was all about the Opponens Pollicis, a Thenar muscle. And I like to have everything on one page when I'm learning, so I don't know about you, if you're a visual learner, it can really help you having everything on one page. And then, you know, there is space so you can add some notes on your own if you wanted. If you'd like a copy of this, do comment and I will be sure to send it to you. And until next time, let me know if this was helpful.